Good morning, nurses. This presentation by Eric Borgstrom, Andrew Mills, Wendy Bryant, Arcelis Gutierrez, and Suzanne McKay will discuss the background and significance of disease process, priority care needs, and evidence-based practices for patients who suffer with sickle cell anemia.
Sickle cell anemia is an inherited disorder of the blood. Normal red blood cells are smooth and able to change shape to flow through blood vessels that are small, while sickle hemoglobin cells are improperly shaped. Because of the sickle cell shape, it causes red blood cells to prevent adequate blood flow. Inadequate blood flow and clumping of these shaped cells causes pain and infections. People born with the sickle cell trait usually do not experience the disease. In order for someone to have sickle cell anemia, they must inherit either a sickle cell trait or a sickle cell anemia gene from both parents. The incidence of sickle cell anemia is 1 out of every 350 births of African Americans, 1 out of every 16,000 births of Hispanic Americans. Sickle cell screening is a requirement of all newborns in all 50 states prior to discharge. Discussing the prevalence of sickle cell anemia, approximately 100,000 Americans are affected by the sickle cell disease. This disease is most prevalent in African and Hispanic Americans and can include those from central India, the Middle East, and areas lining the Mediterranean Sea. In discussing the cost of sickle cell anemia, studies reveal that the cost of medical care is more than $1.1 billion. Approximately 4,300 sickle cell patients were studied from a Medicaid program in Florida. The average cost per month per patient was just under $2,000. About 80% of costs reflect inpatient hospital care. The morbidity of sickle cell anemia. Symptoms and severity of disease vary from each individual. Sickle cell disease gets worse over time. Treatment and prevention of complications is most important. Sickle cell anemia can affect the kidneys, the kidney function, vision, heart, skin, cause chronic pain, multi-system organ failure, and possibly stroke. The mortality of sickle cell anemia. Between the years of 1999 and 2002, sickle cell death rates decreased by 42%, just related to the pneumococcal vaccine that was initiated in the year 2000. Most common cause of death is related to bacterial infections.
Sickle cell anemia is a chronic hemolytic disease which causes red blood cell malformation. This misshapen blood cell cannot carry as much oxygen throughout the body as regular round blood cells. This is purely genetic, and to have the full disease, both mother and father must be carriers. The amino acid valine is substituted for glutamine, causing this malformation. Symptoms of sickle cell anemia is mainly pain due to vaso-occlusion of the vessels, but hypoxia, renal insufficiency, and other ischemic problems can be seen. Homozygous, which is also called sickle cell disease, means that both mother and father had sickle cell trait and passed it on to their kid. Heterozygous is sickle cell trait, which means they don't have as many complications, but they also have a higher percentage of regular round blood cells. Other complications that can occur are ischemic stroke, central nervous system vasculitis, avascular necrosis of the hips, renal concentration defects, renal failure, heart failure, and pulmonary fibrosis due to the circulatory issues. In Central Africa, a study was found that patients that suffered from this disease had less incidences of malaria. Acute exacerbation. Acute exacerbation means that the patient is now creating more sickle cells. This causes pain, as mentioned before, due to the ischemic issues and vascular occlusion. This decreases circulation due to clot formation and can cause other ischemic injuries. Some causes of acute exacerbation can either be physical or mental stress. Stress can be as little as exercise to car accidents. Some hypoxic events that can cause this are higher elevations and a sudden decompression of an airplane.
Since there is no specific medication to help with anti-sickling, the only way the professional can help is through the treatment of symptoms that are present. Analgesic and adjunctive medication is often used for pain control. IV hydration helps with the dilution of the blood and with helping sickled cells move through the capillaries. Broad-spectrum antibiotics are often used for the prevention of infections that can occur in the lungs. Immunizations are also offered to help with the prevention of infections. Often, transfusions may be indicated if the patient has a low hemoglobin and will help transport oxygen throughout the body.
So the three prioritized care needs of a client with a sickle cell anemia, number one will be ineffective breathing pattern related to pain, fatigue, and hyperventilation, as evidenced by labored breathing, rapid respiration, and use of accessory muscle to breathe. We are expecting that the client in about 30 minutes and beyond will verbalize easy breathing, and by the end of the shift, the patient will be able to demonstrate breathing exercises. Nursing interventions are assess and document respiratory status, count respiration in a full minute, evaluate deepness and pattern of the respirations, and look for sneezing, coughing, gasping, crying, and the use of respiratory accessory muscle, as well as for chest retractions. Number two will be provide patient with oxygen. Number three, obtain an order for respiratory treatment, call respiratory therapists to perform nebulizer treatment, sit the patient in a chair if possible, or elevate the head of the bed. Number four will be teach and reinforce breathing retraining. The rationale for this intervention is evident by several studies that change in patient respiratory status is because of respiratory failure is the most frequent cause of death in patients with sickle cell disease. Assessing and treating promptly serious complications is imperative because acute chest syndrome can lead to immediate death. Also, the administration of oxygen is very important to treat hypoxia and to control the cycling. Sickle cell crises often require hospitalization. Rest is very important to reduce metabolic requirements and to prevent further complications like respiratory failure. Medications and respiratory therapy promote easy breathing. Administer prescribed medication to the patient to treat underlying cause of dyspnea. Patient education should include conscious control of respiration rate, the use of accessory muscle, pursed lip technique, and assisting device such as rocking bed to promote more effective breathing. The second priority need will be impaired comfort due to acute pain, as evident by acute distress, inability to relax, fear, and patient saying, "I am in pain." The client outcome will be patient will tolerate pain level, will be have a tolerable level of pain in an hour and beyond. Second one is patient will be able to watch television at the end of the shift. Nursing intervention. Number one will be assess patient level of pain using the 0 to 10 scale, where 0 is no pain at all and 10 the worst pain ever. The second intervention will be administer pain medication such as Dilaudid 2 mg intravenous as prescribed. Number three, provide patient with privacy during this crisis and distress. Number four, teach patient how to use the television system that the hospital provides. The rationale for these interventions are nurses will have to determine the cause of patient discomfort, such as physical pain. Suffering pain can cause to the patient insecurity and lack of control, which lead to emotional distress. Nurses should treat and manage medical conditions that create physical discomfort, As we know, sickle cell crisis is a severe exacerbation of the red blood cell cycling, causing a vaso-occlusive crisis. These crises are very painful to the patient, as several research show. Determine when the patient desire for environment accommodation and provide enough privacy, natural light, and access to outdoors. This situation is very stressful for the patient. The use of distraction like music, watching television or videos, chatting, texting with loved ones, and or playing computer games limit unpleasant sensations and situations and provide more comfort to the patient. The third priority need, which is not the least important, all three are very, very important, is activity intolerance, inability to walk down the hospital hall without shortness of breath and fatigue, related to very low hemoglobin level, as evidenced by patient reporting of weakness as dyspnea with mild exertion. The patient's expected outcome will be patient will be able to breathe better in 30 minutes and beyond. Patient will be able to walk to the bathroom at the end of the shift without fatigue. The nursing intervention will be assess and document heart rate, respiratory rate, oxygen saturation, blood pressure, and level of consciousness. Also, the second one will be review respiratory values like complete blood count, blood gases, and cardiac enzymes. Number 3, administer supplemental oxygen and medication such as pain relief drugs. Number 4, teach patient how to use a walker to go to the bathroom. The rationale, the scientific rationale behind this intervention are rule out acute complications like respiratory failure, arrhythmia, heart failure, and pulmonary disorders, because activity intolerance implies that the patient cannot adapt or endure activities that require energy or oxygen demands. The typical sickle cell patient is anemic but asymptomatic except during cycling crisis. Blood transfusions are required very often during crisis. Also, routine oral folic acid is strongly recommended. Medication and other treatments such as blood transfusion are used to improve myocardial perfusion and systemic circulation. Blood transfusions are used to treat severe anemia. The use of oxygen and bronchodilator help to improve respiratory function. The nurse should teach and monitor how to use the assisting devices to maintain mobility and prevent injuries. Recurring episodes of severe pain plus the underlying chronic pain that these patients suffer can be very disabling and depressing for sickle cell disease patients. The patient quality of life with sickle cell anemia and in general with all sickle cell disease can be affected profoundly. Occupational therapies and physical therapy can be used to achieve optimal physical function and independence.
The most common complication of sickle cell disease is a vaso-occlusive pain episode. The main concern for nurses is getting the patient's pain under control while in the hospital. Doctors prescribe a pain regimen of opioids such as morphine or Dilaudid, oxycodone, NSAIDs such as ibuprofen, and Tylenol. For severe pain episodes, doctors will order patient-controlled anesthesia as well. Nurses play an instrumental role in controlling their patient's pain by assessing their pain level on a 1 to 10 scale, providing pain medication in frequent, scheduled intervals, and monitoring their patients to make sure oversedation does not occur. Other options for pain control that nurses can provide are heating pads and distraction through TV watching. IV hydration is necessary for patients who are unable to drink adequately as dehydration contributes to a pain crisis. The role of the nurse in this case is to monitor intake and output and to encourage oral fluid intake when the patient becomes capable. The second most common complication of sickle cell disease is acute chest syndrome. Nurses need to assess their patients for coughing, shortness of breath, rapid breathing, and watch vital signs for fever. Oxygen therapy with a nasal cannula and doctor-prescribed antibiotics should be provided as soon as possible. Severe complications may require blood transfusions. Nurses should monitor hemoglobin lab levels. A reading of 2 grams per deciliter below baseline could indicate a serious problem.